Okay, so I'm here with Alex, and we're talking about the Terahertz wand, and she's going to give us a basically an overview of her experience with it. And just as a disclaimer, we're not making any claims or anything with this device. Individual results may vary, and if you have a serious health condition, consult a doctor, or in this case with the pets, consult a veterinarian. So, Alex, thank you for getting on the phone with me today. So we made contact. I told you about the terahertz. You got the terahertz wand, and I know there was multiple uses that you had with it. One was for one of the pets, and then it was for you. So which one do you want to start with first?
Well, we could start with my dog.
Let's start with the dog. Okay.
Okay, so I'm looking at a doctor visit report dated 11/10/2021. Patient name, my dog's name Diva. Age 9 years, blah 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 blah. Cocker mix, 23 pounds, blah 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 blah. Okay, this is what it says. They gave an exam and then everything they checked normal, 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 except when they got to mouth, teeth, and gums, and then it checked abnormal. Remarks: moderate dental disease and sublingual mass, approximately 1 to 1.5 inches in size and 6 to 8 mm in width, right?
Yeah.
And then in the remarks on the bottom, it says assessment: lethargic, vomiting, and bloody diarrhea. R/O gastroenteritis versus pancreatitis versus metabolic disease versus food indiscretion, blah, blah, blah. Number 2, sublingual mass. And then capital R/capital O. Neoplasia, benign versus malignant versus cyst. Advised to consult oncologist ASAP. Owner has info for the oncologist. Number 3, periodontal disease, stage 2, gingivitis. Number 4, geriatric pet. Plan: recommended x-rays, adult wellness blood count, CPL test, IPS, and Glardia, I don't know what that is, antibiotic injection, famotidine injection, ondansetron, metronidazole tablet, sulcrafate, all these things I can't pronounce.
Okay.
Anal sac expression, blah, blah, blah.
Right.
Then it says, discuss the mode of action, side effects of the medications to go home with the owner. Prognosis, fair, guarded. A clinic, if condition gets worse. Prevective for oncologist at Sage ASAP in all capitals. So he gave me the number to a oncologist at a I guess the name of the company here in Northern California is called Sage. So I didn't call him because, like I said, I didn't have the money. I didn't have the money. So I just said, I'm gonna do my, my own thing for Viva. And I got the iTero wand and I started doing, I looked at the acupressure points, her head, and then I would do it at medium heat, like the middle setting,
Yeah.
on the side of her mouth, and she would, after a while, she really started to enjoy it. Then I would turn her on her belly, do her chest, her heart, her organs on her belly, her hips, her thighs, her throat, and over and over and over. I'm not kidding you. Within 10 days, I started to see that I could see her teeth again. So let me tell you what the report said. Just hold on a second. From the second doctor, Bishop Ranch Veterinary Center. Okay, this is dated 3/21/22. Now I got this little wand thing at the beginning of March. Okay, here's what it says: presented for evaluation of lump on the inside of her mouth. Owner concerned for foxtail. Came here a few years ago for not wanting to eat, and she had a temperature, had a foxtail on her foot. Owner walks on the trail. Found the lump a few months ago. No draining discharge since. Was seen at San Ramon Vet and was noted to have a sublingual mass 1.5 centimeters times 6 to 8 millimeters in width. Owner had copy of record on phone. Was recommended to see an oncologist. Meds none. Her food is origin and origin canned and kibble. Energy a little bit lower, not eating as much over the past few months, blah, blah, blah. Physical exam, they give you all of that. Oral, moderate tartar when panting and lateral for blood draw. Visualized as best could. Sublingual region, unable to identify a mass.
Wow.
Unable to identify a mass. Period. Assessment. History of sublingual mass, R/O cyst versus Cial-Sale versus neoplasma. And then it says, unable, physical exam, discovered that on PE alone, unable to identify sublingual mass. Owner states previously it was large enough that it was hanging out of her mouth. Owner too could not visualize today. Mass may have regressed if drained, cyst, etc. Owner elects to proceed with pre-anesthetic blood work and SPF. If mass present at time of dental, will biopsy to care. But then I said they wanted to charge me $2,700 to clean her teeth and then look and see if there was a mass. And if there was a mass, they were going to biopsy it, remove it. And I was like, no, because it's gone.
Exactly.
I'm not going to spend $2,700 that I don't have.
Right.
But they did do the blood work on her, and then they contacted me, and they said she's in fantastic shape for her age. And I know it's because of the iTera wand.
The Terahertz.
I know it.
The Terahertz wand, yeah.
Terahertz wand, whatever. Dude, let me tell you something. I thought she lost teeth because her gums were so red and inflamed that it was over her teeth. Now you can see her teeth, and they're all white.
Wow.
I didn't clean her teeth or anything.
Wow.
It's incredible. The gums receded. They're no longer swollen. They're no longer red. They're no longer inflamed. It's incredible. This is crazy.
So, Alex, I know when I talked to you at first, you were in a lot of anxiety and stress because obviously that dog means a lot to you. And we were looking, and I told you that this technology that this thing has would be, in my opinion, the best option. And so this all happened you said within 10 days?
Within 10 days.
Wow.
And the reason I went back in, actually, was because I suspected she had another foxtail, maybe in her mouth or something. Because, I take her on the trail, and right now it's foxtail season. And last time she had a foxtail between her paws, and it was embedded like 1.5 inches. They had to surgically remove it. So I just wanted to make sure. But while I was in there, I was like, look at her teeth. And then I showed her the report from the other doctor. She said, you know what, maybe let me take her in back and see if I can find it, because I'm not getting able to see anything right now. Where is it again? I said it was on her under her tongue on the right side. And before, if you just lift it up, pull her mouth open, you could see it. It was kind of hanging out a little bit. And she couldn't see, so she took her in back even, with a tech helping her. It's gone. It's gone. And more importantly, her teeth are no longer like, you can see her teeth. I couldn't see her teeth before. I thought she lost some teeth. It's crazy.
That is crazy. God, that's such a great story, though.
Insane. And let me just tell you something. Can I just...
Of course.
A little addendum?
Yeah.
So I bought the 9010... actually, I can't say anything negative about the 9010. So I bought the power capsule, and I bought the Tesla biohealers, and I bought the Tesla biohealer for my dog. But I had that for a long time, and nothing changed in her mouth. Nothing, her mouth, it's when I started using the iTera Care Wand thing, it was so fast that I noticed it. It was so fast.
Yeah.
So then the other thing I want to tell you is, so back in the day, I lived in LA for 30 years, and, I used to go get like laser, what do they call it? Clear and bright, where like it evens out your skin tone, it gets rid of any uneven skin pigmentation.